My name is Gerke Lange, and I work with the Quality Improvement Team at Sheffield Health and Social Care Foundation Trust. Quality improvement takes time, and it is helpful to follow an improvement process. This is a quick guide on change ideas, a key element in the improvement process. In the next 5 minutes, I'm going to cover the following. What are change ideas? When, by that I mean at what point in the improvement process, do we explore change ideas? Then, how do we come up with change ideas? Here I will share some tools and approaches. And finally, I will share some tools that can help us with change ideas in the virtual world. Change ideas are ideas for improvement. A change idea being a different way of how we are doing things. In the improvement process, the change idea addresses appropriately the specific aim. Remember, it is helpful to keep it specific and clear. So how do we ensure for a change idea to be a valuable improvement? Remember to consider two factors. The first factor is the importance of measurement. Start with measuring the process where you feel improvement is necessary. This gives you a baseline. The change idea then helps you to redesign the process you're hoping to improve. You then measure the improved process. Remember, for each the baseline and the improvement measure, a general rule of thumb is to have 8 till 12 data points in order to make the measurements meaningful. The second factor is getting everyone involved. Remember, for a change idea to make a difference to everyone in the team, it is important to come up with change ideas together. That means working it out together, not settling on the first idea, not starting with the solution. Now, it is important to get everyone involved, so that everyone can have a say and put their ideas forward. There are a number of different tools and approaches available that enable us as a team to come up with change ideas. What knowledge do we have about best practice, and what do we know about areas, services, where the process we are looking to improve is working well? Drawing on Nolan's change concepts helps us to identify how our change idea will make a difference. For example, manage time better or change our work environment. And thinking about our different individual preferences and how that impacts on our managing change, De Bono's 6 hats can provide some helpful insights. Remember, it is drawing on everyone's values and skills to contribute to change ideas that will truly make a difference. Now, brainstorming is an easy way to get everyone involved. In order to utilize brainstorming, it is helpful to start with ground rules. Ground rules enable us to create a space for everyone to have some time to think and write down ideas. Here it is beneficial to agree that there will be no discussion during the quiet phase. And when sharing ideas, there's no criticism, not even a groan or a grimace. Finally, an invitation to everyone that we build on each other's ideas. All ideas will be written on a flip chart for all to see. This supports a context of acknowledging that no idea is too big, too small, or out of the question. When using brainstorming, it is helpful to bear in mind that we are all different and will have different preferences in the ways we like to contribute. In a group, we always will have natural talkers versus introverts. It is important to remember that we all bring value. Let's empower every voice to be heard. The brainstorming process supports this. Start with the silent period. Think about improvements to the process and write your ideas on post-its. This is followed by the interactive period. everyone reads out their ideas and sticks them up. Other ideas that come to mind are shared, no matter how crazy they seem to you. Remember, creativity helps building on different ideas. Now that everyone has contributed their ideas, all team members take part in multi-voting in order to come to a consensus, to share thoughts and feelings on a few top ideas to focus on. Remember to review all the ideas, group similar ones and remove duplications to narrow the list down. Everyone votes for 1/3 of the total number of ideas on the list. In this way, everyone agrees what to do next based on specific criteria. Criteria such as, can the idea be started fast? Is the idea of reasonably low cost? Is the effort small compared to the impact? And can the idea be tested without getting permission from others? Finally, the votes are counted and the idea with the highest vote, that will be your chosen test of change, is planned accordingly. Here are a few examples of change ideas. Support staff arrive 1 hour before clinic opens. A change idea to improve management of time. Standardize rooming versus guidelines. A change idea to improve work environment. Serial scan sticker in front of notes and on patients' handheld notes. A change idea to manage variation. To conclude, we are all now working a lot more virtually. Jamboard is a helpful tool to come up with change ideas virtually. Here, everyone in the team can contribute, that is through writing post-its and drawing ideas on a whiteboard. Remember, for a change idea to be meaningful, we need measurement and everyone involved. Thank you for listening, and I hope you found this short guide helpful. If you'd like to know more about this or any other quality improvement tool and how they can help to make improvements, please get in touch via our team email address qiteam@shsc.nhs.uk.